So today it's June 26th, day before second day of step 2. So I'll be taking the day in which we have these CCS cases tomorrow. So what I'm going to do is I'm going to try to record my last 5 CCS cases so you can see like what I'm doing. If this works out for you, great. If you have good pointers, advice, let me know. So yeah, we're going right at it. So we're gonna choose the cases. Actually, what I'm doing is, since I couldn't take all the cases, what I'm doing here in this great application and great software, which I highly recommend for studying for this section of the test, what I do is I press on high yield and I'm just taking the ones. See, I took this one from here to here, so I'll keep on taking like 5 of these others high yield because that's the most possible thing that will be on the test, and I don't have time to finish all the other cases. So let's go for this one. What I don't like seeing is on the left side of the screen because I don't want to know what's the topic, what's the branch of medicine. I don't want to go in there with any sort of advantage. So we're gonna choose this one and run the case. Okay. A little slow. Yeah, that's not gonna work. Okay. 30-year-old female president, generalized weakness 4 weeks. Tachycardic. Normal pressure. Afebrile. Okay, so she has myasthenia gravis, basically. That's what they're telling me. Okay, so nothing special here. Okay. Okay, so we're in the office. We can stay in the office. There's no need to examine anything quickly. So let's say yes to all this. And I'm hating this internet. Okay, yeah. Well nourished, everything. Okay, normal. Myotosis, I was waiting for this. Okay. You have to learn how to skim through this and just look for the word normal. If you don't see normal, go back to it because you don't have much time. For proximal muscles in both upper and lower extremities, findings are okay. So now we're gonna send the exams, so we can stay in the office. I don't think we have to leave her there. So CBC, CMP, she is a female in reproductive age. Urinalysis is okay. TSH is okay. Prolactin, better send things even though they're more than what they're asking for. Rheumatoid factor for polymyalgia rheumatica, erythrocyte sedimentation rate, CRP. What I'm looking for is for these antibodies, acetylcholine, acetylcholine, antibody. If it doesn't appear there, we'll see it here. Chest X-ray, pulse. She didn't say she's short of breath, but okay. What else can we send her? That's enough. We can see her in the office. Don't think we have to. Yeah. Oh, forced vital capacity, forced expiratory. I think this is to see how is lung function. And you can also do other things for tensilon test. I think it's one tensilon or ice pack test or something like that. It improves with myasthenia. So let's ask for all those things. I wouldn't have her in the office. Serum beta urine qualitative. There are some things I wouldn't ask for, but since the test usually won't penalize you for asking for things in excess if they do not harm the patient, I would go for it and ask for it. Something like this, I wouldn't ask for a anti-nuclear. Okay, this one, activity receptor antibody, there it is. And we could see the other one, but well, antibody, we already asked for that one. What's the other one? The other one is Lambert-Eaton, and that one is postsynaptic. Postsynaptic, we'll see shortly. Postsynaptic. She's breathing fine. Respiratory flow. Let's ask for these two because I actually don't know which one is the one we should ask for. So, okay, we already asked for that. Tensilon test, there it is. The ice pack, no, don't want an ice pack. Okay, so, and let's send her home. No, let's see how she's doing. Let's see how she's oxygenated. 90. Interesting. So let's go with, I told you, oxygen therapy. So she's not going home yet. And let's send her. She is, yeah, not going home yet. She's going to the inpatient unit. That's what I would do. Let's see other things for her. Negative. So this might take a while. What we'll do is we'll see results in 30 minutes. Okay, everything's normal here. Everything's normal here. X-ray, widened superior mediastinum. Mass in mediastinum. See, usually this is associated with tumor. It could be secondary myasthenia due to a tumor generating these antibodies. So we want a CT scan, the chest with IV contrast. And let's continue seeing what happens. Calcium, blah 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 blah. Everything is normal. If you don't see an asterisk in this section, it's normal. Consistent with thymus, and right here, thymus. So we probably have to resect that. Do we want a biopsy? Let's see if this appears. Thymus. See, there are some things we don't know. Thyroid. No, there's no thymus biopsy. Thymectomy. Okay. That thing, we actually don't know the real use of the thymus when we were older, so let's go for a thymectomy. But before that, let's stage this. Do we want to see other places? Okay, CT scan abdomen, CT scan pelvis. Probably not necessary. It looks localized. No, let's take a biopsy. Thymectomy. Let's choose that. I'm not sure what's the answer, but let's oncology. Let's get oncology on board. Let's get neurology. Who sees these things? Immunology. I don't know, but it won't harm. So let's see what happens. There we have it. Yeah, they don't care. They won't read whatever you write there. Okay, yeah. And immunology, okay. They won't deduct points on this. Let's see how she's doing. So let's remember how she was feeling, what we can add. Complaining of progressive generalized weakness that has been occurring, her symptoms worsen at the end of the day, and she reports, okay, pyridostigmine works in myasthenia. Let's give her pyridostigmine. I'm not sure if this will work here, but well, she has no CNS symptoms, then pyridostigmine should work. Let's give it, and let's see how she's doing. Feel weak. She has oxygen. Let's see what else. Yeah, erythrocyte sedimentation. Okay. Vital capacity is okay. This time, we already gave her treatment. Thyroid hormone. The case will prep. Okay, surgery. Nice. What else is going on? Yeah. Oh, damn. Let's see. I didn't see her vital signs. 37. Same thing. It didn't give me any new information. Okay, so 9 minutes. Probably they're gonna stop me shortly. She's in the inpatient. She's okay there. What else can we do? Pyridostigmine. We gave her that. Biopsy can't. Biopsy. Biopsy. Endometrium. MNOPQRST. No. Transbronchial. Okay, can't take a biopsy on that. Not sure if we send a CT of the abdomen and pelvis, if it's gonna do her any good. Is this advanced or not? Let's ask for it. CT abdomen, CT pelvis. Should be probably with, but let's ask for it without at least. We're just playing around here a little. Abdomen. Okay. There you go. And what else do you have? We want an EKG. We want blood and group. Yeah. We want typification because she's going for surgery. No. Group. What else? She gets tired and all that. 11 minutes. We have to recommend her, yeah, to stop smoking and all that. And what else do we want? Order sheet, all those things. Progress note. Coagulation. Mm-hmm. 3 years ago. She doesn't need a PAP right now. Or yeah, 3 years ago. Okay, let's do a PAP. Okay, so we're already asking for extra things. PAP. Let's see what's happening. This is day 2. Let's go. Normal. See, instead of seeing it the whole thing, you can just, what's this? Okay. We know you're weak. We know it. I don't know what else to give you. Oh wait, what was that last one? Antibody, vital signs, imaging. Normal. Yeah, already knew this. We already have the diagnosis. I had already given her pyridostigmine. Yeah, there it is. What else do you want? I think I've done everything. Call me with yeah, let's go. Let's go. Call me as needed. I'll have to stop this. Okay. Okay. So she has oxygen therapy. So non-invasive ventilation. Let's see. Gases. A lot of gases. Still 90. I already gave her oxygen. So don't know what else I should do. Intubate. She has a mass in the thymus. She's saturating. Protect airway. Okay. Blood gas. Yeah, of course, I wasn't gonna send that shit. Mm-hmm. Safe sex. Yeah. Mm-hmm. DPT, always safe sex. CCS cases. Safe sex. DPT, always send that shit. Yeah, shouldn't have ordered that. Mm-hmm. Okay. Hmm. Okay. Got it. Closed. Okay, that's it. Don't like how this thing is so slow. So that's it. You saw it. And that's it. See you later.